So let's do it. So I'm Dr. Joseph Hammer. I'm an assistant professor of counseling psychology here in the Educational School and Counseling Psych Department here in the College of Ed. And we are in the College of Ed, whereas all the other psychologists are in the Department of Psychology and A&S, Arts and Sciences. There are weird historical reasons why you have 3 flavors of psychologists over here and 4 or so over there, but that's what it is. So I've been a professor for 4 years. My research is in what stops people from getting therapy when they need it, and also how to measure psychological things well and fairly across culture. And I teach people how to do therapy, teach our master's and doctoral students, and I'm the director of training for our counseling psych PhD program. And we can, as you want, talk about our PhD program and our master's program, but the larger purpose of this is about our field of counseling psychology. So I'll say a little bit about our particular programs, but I want to educate you on the larger field, of which there are about 70 PhD or PsyD programs in counseling psychology that are APA accredited. And there's about 150 clinical psychology programs. And we'll talk about what the heck's the difference between those two and stuff like that. But yeah.
Hey, I'm Dr. David Pascale-Hague. I'm actually a graduate of the PhD here in 2015. I currently am a licensed psychologist, and I own my own private practice here in town. My office is over on High Street. And in my practice, I specialize in working with LGBTQ people. And also, as a generalist, I work with adults in my practice. So a whole garden variety of concerns: anxiety, depression, mood disorders, trauma, family of origin concerns. So through my training, I have this generalist training, and then just one part of it is really my specialty work, working with people who are LGBTQ or some part of the community. Previously, I spent a lot of time at university counseling centers. I did all my training at universities, so I have a lot of experience working with young adults and grad students and undergrads as well. So hopefully can share a little bit about some of the career paths and how I got to private practice.
So you've worked in both private practice and university counseling centers. So if you're thinking about...
And I teach.
And teach. So those are some of the things that he knows a lot about.
I pay the bills.
My name is Carolyn Meiller. I'm a third-year doctoral candidate in the Counseling Psych PhD program. I also did my master's here and then reapplied to the PhD program. So this is my 5th year here in the program. My research kind of broadly focuses on sex. Right now I'm working on my dissertation proposal, which will look at sexual pleasure for curvy queer women. And I'm really excited to get that up and going.
That is awesome.
I'm pretty psyched about it.
It's curvy.
So I'm pretty excited about it. I do qualitative research as well. It's like interviewing people and doing that type of research.
So like in grad school, she's in my lab, and I was like, whoa, she's so cool. Hey, my name is Natalie. I think I'm the baby of the panel. So I'm in my 1st year PhD program, counseling psych. I'm also a recent graduate of the University of Kentucky, so I graduated with my bachelor's in psychology back in May. So I came straight into the program. My research interests are love, sex, social justice, and intersectionality. And specifically, I'm interested in working with African American women and communities of color. Down the road, I think I'm interested in private practice as well as working for a university. And I'm excited to be here.
So that's us. So let's take your questions.
Okay, I'll start.
Break the ice.
Okay, this is my 1st semester back after 20 plus years of having an uncompleted bachelor's, okay?
Welcome back.
Thank you, raised my kids, it was terrifying. I'm a little better now. Until this past Monday, and then there was a panel discussion in the psych department about some things, and I got really confused because, quite honestly, in 1999, there were a lot fewer paths to get to where you wanted to be, it seems. And where I want to be is marriage and family therapy, maybe teaching, some on the side, that sort of thing. That's where my heart is. So, but I came back as a psych major because that's where I left and that's where I thought I needed to be. Now I'm not so sure. I would like to be in private practice at some point, have my own shingle, and try and help people just manage the traps and travails of life. So because I've been helped so much from people like you in my life.
So are you second guessing a psychology undergraduate major is the first step?
Yes. So I'm wondering if I should go to the social work program. I'm wondering if I should transfer over to family sciences in the ag department, but then I didn't realize there was a psych department in ed, so that was bing, 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 like a newsflash to me just now. So I'm sitting here at midterms of a first semester back after 20 plus years, now wondering, what do I even do? Now my advisor says she thinks I'm okay where I am.
Right. Yeah, we have.
Let me just say, research is not going to be my thing.
I have a relieving answer.
Research is not going to be my thing.
I know, just in my experience, right? My undergraduate was psychology, general psychology, arts and sciences, and after that, I mean, I got into social work. I worked with senior citizens, worked with hospital placements and long-term care placements. So I think with the arts and science psychology undergraduate, you could be equipped to then take a next step into a variety of master's programs or other graduate training, right? Because it sets you up with the curriculum kind of across the board. Now, if you are starting to get a sense of, you already have a sense of the kind of work you want to do after an undergraduate, how you kind of dovetail other things in to a psychology undergraduate can be really important. So when you do a shadowing experience, can you go and meet with a social worker? Can you meet with an LMFT, a marriage and family therapist? Talk with a psychologist? Because you have to think about that undergrad psychology major is setting up the foundation, and you're going to be able to put other things on top of that. So I, just speaking in the short little bit you told us, I think undergrad psychology can make a lot of sense, and it's going to be more about what is that next step that gets you a license, that gets you into the field in a capacity that is a good fit for you. And I think one of the big pieces in making this decision between an LCSW or a marriage and family degree is, okay, what kind of freedom do you want to do your work independently or under supervision or with a team, right? And what kind of populations do you want to be working with, right? So I joke that I'm not good at couples work because my couples don't ever patch things up. And for some of them, they already come in and they're fine with that.
Or maybe,
right?
maybe you are fixing the couples.
So, for me, getting my PhD in counseling psychology specifically was because I wanted to be able to work independently with the PhD as an independently licensed psychologist. I did not want to be under supervision.
So how long did it take you to achieve
So
that?
I did my master's here. I applied, I got into the master's. I did that in 2 years. And then it took me 4.5 to 5 years to get my PhD.
Okay.
So I was here from 2008 until 15.
Okay.
So, but I got licensed with my master's degree, and I started working with my master's degree while I was still in my PhD, because I have a child and I had to pay the bills. So
Right.
there are options.
Yeah.
So
Yeah. At this point, I got to pay the bills. So okay. Thank you.
Yeah, great question. Others?
What would you say with PhD training the primary differences are with counseling and clinical?
Yeah. So the big question. I have a whole
The floor
webpage.
is yours.
I have a whole webpage on my website dedicated to the differences and similarities. If there's one thing you walk out with, it's that they're mostly the same. Now, this is my opinion. I like to think I have an educated opinion, but you'll ask other people, and some people will say they're miles apart, and so listen to lots of people and make up your own mind about who's correct. I think they're mostly similar, and a lot of the data holds that out. They come from different historical backgrounds, which is why two separate things exist, but we mostly do the same stuff. We both learn how to do talk therapy, learn how to do testing and assessment to diagnose or figure out what's going on with somebody. We can both be trained to do research, to teach and train new therapists, to do social justice advocacy, consultation, consulting with organizations. There's a lot of transferable skills that we learn. So generally, we're more similar than different. But there are a few, on average, differences. Like counseling psych programs as a whole tend to lean towards these strengths and weaknesses, and clinical psych tends to lean towards these strengths and weaknesses. So some of those, and please, chime me in on things you've heard. Some of the big differences are, in counseling psych, we focus a lot on cultural identity and how that influences health, therapy, our relationships with each other, concepts like power, privilege, and oppression. What are those? How does that operate? How does it make certain lives people easier or different? So we look at a lot of cultural identity. We look at career and vocational psychology, so how people can find and thrive in meaningful work. That's a specialty thing that we're all trained in. We look at a holistic approach to people and trying to prevent things as well as intervene when something is wrong. Hello, Dr. Candice Hargons. So once you get set up, we'll,
There's a friend in here. Baby Dr. Hargons.
There you go.
So Dr. Hargons, do you want to give your 45-minute, hey, this is me?
Yeah, 45
Oh,
minutes.
second.
Well, she could pull up 45.
She could.
My dissertation on self. My name is Candice Hargons. I am in my 4th year as an assistant professor here in the counseling psychology department. I am the director of training for the master's program. So anybody interested in master's work, I would be your go-to person. I study sex, social justice, and leadership with a love ethic, and I enjoy this. Is my dream job. So I'm just really happy to be here, happy to talk to people about all the good stuff we got going on at UK.
Well, that did say about 45 minutes.
Yeah, we learned to be concise. So we were just talking about distinctions between clinical and counseling.
Okay.
So we were talking about mostly similar, but we lean on average towards different emphases. On clinical psych, on average, they tend to have a more in-depth training and testing and assessment. So that tends to be a bigger chunk of what they learn. They tend to be more likely in hospital and medical settings, whereas we tend to be a lot more in counseling, university counseling center settings. And again, you see both in both, but it's just in general, you'll tend to see a larger percentage in those areas. There's some other stuff, but you want to jump in on distinctions you feel like you've picked up on or believe exist?
All of us can do private practice. All of us can do the professoriate route. So if you want to be a professor, like there's tracks for both of that. But I think our values are different, and so multiculturalism and social justice are really grounded in counseling psychology, whereas you might get one course in clinical and it might focus more so on like inclusion and diversity. We focus on how you change systems to better affect people's lives. We also think more so about people's strengths, so not just their psychopathology, but also what they bring to the table as protective factors that help them make it through really tough stressors and traumas and things like that. So we highlight that. We value prevention as well. So how do you help people get to the point where they might have been predisposed or have community or context conditions where there might be some psychopathology or some things that show up, but we're making sure that we're in a community setting and we're working with people before something happens as opposed to when it happens or how to manage crises. We do it all, but those are kind of the ways we lean.
And there's some
vocational.
Yeah.
So like how Dr. Hammer's really great on this, like career-focused stuff, people choosing careers that are really great for them, and we have a good career practicum that helps people with that. Making sure that you live a good work-life balance, stuff like that.
Yeah, so you can kind of hear some consistency in what we're talking about. So in general, especially at the doctoral level, what's going to make more of a difference in terms of what skills or competencies you get, it's going to depend on which particular program you go to. So there are some clinical psych programs that are more counseling psyche than some of our counseling psych programs, and vice versa. So it's really about who are the faculty at that and what do they do research on. How do they teach people to do therapy? Is it manualized evidence-based treatments, or is it a focus on the common factors that drive what makes therapy effective, like the relationship, the bond between therapist and client? So there are some distinctions program to program. So if any of those things we talked about as being strengths one way or the other really speak to you, you might consider those programs first, but don't rule out the other side, right? Like when you're applying for PhD programs, usually you're applying to work with a particular professor under their research interests, and so it's about showing your fit with that person, whether in a counseling psych program or a clinical psych program. You can apply to both. Other?
I can add something from like an applicant perspective. Something I found was that some counseling programs might not be in like an education department. So for some of them I looked at, they were in an equivalent to like arts and sciences at UK. So that might be something that can help you look at those general strengths and weaknesses we talked about, and then within that as well, just looking at the faculty members and what their research interests are. And what's great about APA on the website is that they can show you where the programs are, whether they be clinical, counseling, etc., and that can help you sort of navigate where and who you want to find. I will say it's a lot more limited for counseling sometimes, and then especially when you get into your research interests and things like that, you might find a smaller pool, but the options are still there. So it's really just a matter of getting a really well-rounded look at what everything is and what there is to offer.
And if you go to the Society of Counseling Psychology's website, that's our crew, we all hang out in the Society of Counseling Psych, it's div17.org.
Pardon me?
It's div17, div17.org, which it's Division 17 of the American Psychological Association, one of the many. There's one page on there where it's a giant list of all the programs with links to every single program website. So if you want to explore broadly, go to that one page and you can navigate to all the programs easily. So you don't have to dig through university websites looking for where the counseling psychologists live. Yeah, great question. Other questions?
Yeah. Curriculum-wise, or like type of classes-wise, what's the difference between the clinical and counseling psychology?
I can jump in there. So we have to take a certain number of core classes that are the same, but here we have a social justice consultation class, whereas in a clinical you might just have a consultation and supervision class. So ours is focused on a community-oriented project. We have classes that professors can teach that are their specialty areas. So I'm a qualitative researcher. This summer I taught a qualitative research class. You don't often see that as much in clinical programs. You'll see more quantitative research focused. So mixed methods and qual integrated with quantitative, you'll see more often in a counseling program. Differences in classes.
We have career vocational classes.
Like, which is a requirement. Yep, the career class. So I think those are the three that I'm thinking of off the top of my head and how they might be different.
I think also with the courses, so like since we're in the College of Ed, we also take classes with the education psychology. So like we take classes like motivation and learning and things like that do sometimes have an education spin to it. Whereas if you're in a psych department, regardless of if you're in a clinical or counseling program, you might have a different leaning of some of the classes.
Mm-hmm. And the big thing to know, and the relieving thing, is when it comes to course curriculum, there's not a huge amount of difference, because every single APA accredited counseling or clinical psychology PhD or PsyD program must have a core set of about 7 specific topical areas, and then about 10 or so specialty areas related to therapy. So you'll see the same classes everywhere. They're all required to teach them. So 90% of the curriculum, I mean, different professors will teach it differently, but you won't be able to tell that as an applicant how they're going to teach a given class, right? But all accredited programs have the same courses, but the extra stuff, the icing might be different. So don't worry as much about that piece, I would say. One less thing to worry about.
And even through my counseling psych PhD here, I was taking classes in clinical. I was able to also take gender and women's studies classes. I was able, so there's the core, and then there's a little bit of opportunity that I think the character of the program starts to come out, right? So being here in a program that's focused on social justice and understanding marginalization and privilege, right? There was, within my research program, I was able to kind of say, hey, this might be important. I need to get more in that area. Especially I also was doing qualitative research. So I was able to take some qualitative research methods classes, which I don't know what the experience would have been like in clinical. I just knew I wanted to spend more time doing that type of work and doing more talk therapy. So that was my focus.
What else?
What's the difference between a PhD and a PsyD?
Yes. So one of the things counseling psychologists a lot of counseling psychology programs train focuses to try and be interpersonally aware of each other, and so we're kind of checking in. Like, I'm wondering if I'm taking up too much space in the room, and so maybe somebody else can speak to it. You know, it's hard to train.
We always look to each other like, you got this one, I got this one, you got this one.
Because we care about each other. We want to make sure everybody's voice is heard.
Yeah, I'll jump in since I didn't have a lot of time in the beginning with you guys. So a PsyD program is training people who are practitioner scholars typically. That means their main focus is that they want to go into clinical practice. They know that at the beginning. And so they may not have a dissertation requirement in the same way. It may be like a project that they do, but it's not this extensive research trajectory, which you will see in a PhD program. When you're pursuing a doctorate of philosophy in any degree, then you are looking at a track of research. Like, you're creating a research program so that the larger portion of what you do is preparing to know how to conduct and execute research projects. Now, both of them will tie it to how does that apply to therapy? How does it apply to clinical work or the experiences people are having? So the knowledge is going to be translational for both. But for the PsyD program, typically you're saying, I know I want to practice, and this is what I'm going to go into so I can get those practice skills. They'll typically have thousands more hours, like 1,000 more hours in their practice than a person in a PhD program, because they're not taking as many PhD level research classes, basically. Stats classes and all of the research methods stuff, they won't have as many.
And that's something is that something you start planning during your master's work?
You can. Because a lot of the students this year who are applying to doctoral programs, there's like a half, 50-50 split of PsyD and PhD. And they knew in the master's, like, I want to keep doing this clinical work predominantly. I'm tired of research. I'm already tired of research. Yeah. Or like, I really love research. I want to do practice as well. And so I want to make sure that I have all the skills I can possibly get in research and be really competent in practice. So that's the balance.
So there's some thematic differences there, and there's also some other key on average differences between PhDs and PsyDs that we have to mention, which is debt.
Yes.
Amen.
So,
that's a real life thing right there.
So PhD programs, typically PhD programs, you can give 20 hours of yourself a week to doing a research assistantship or a graduate assistantship, and they will waive your tuition and give you a small monthly stipend, $1,000, $1,500.
Very small.
So enough to defray rent a little bit.
Yes.
So you can expect that at most PhD programs. At PsyD programs, those gigs are very rare. Usually you're just paying out of pocket.
So they're not funded like a PhD program?
No, so you are taking out student loans absolutely for PsyDs. And a lot of the average debt is
It's $100,000.
$100,000 by the time you're through with your 5-ish years of PsyD. Whereas with a PhD, the median debt is more like 20 or 30, I
20
think.
or 40 range, I think. There's an article on it that explains.
Is that, yeah?
Yeah, like there's an article that explains it that one of our colleagues wrote, but I don't know the exact figures.
Yeah. Google,
Yeah.
it's out there, but
it depends
be
on what
aware
you're
of that
coming in
difference.
with your bachelor's and your master's degree already as it relates to debt. That can make the determination between that extra 20 to 40,000.
That could be an extra 40 in state for your master's, right? I mean, before you even hit the PhD or PsyD door.
Yeah.
Wow.
The other piece that I always like to encourage people to look at is every program publishes their outcome data. How many students start the program? How many students leave each year? Where are they after they graduate? They do ask debt questions. And you can also look on American Psychological Association, APA, and you can see the licensure data, who gets licensed, what percentage of people who finish are getting licensed, placement for internship. So all the data is out there. And I always think you have to start a little bit with the end in sight, right? So a program can look great, and they can sell you all the glossy photos and things, but if you look at the data, you can see what they're turning out. And it's very important to kind of know, am I going to be guaranteed funding, right? And am I going to have to search out funding through another department, things like that, to know those questions up front, to know those answers up front.
What helped you guys determine whether or not you would go PhD or PsyD?
Money.
Yeah.
And then also, so I applied to the master's first, but I did apply to PhDs at that point as well. But then through doing the master's, I also realized I did like research. So that was also a piece of it. But ultimately, kind of clinical never really crossed my mind as much.
So if you know you want, if a person were to know, okay, I want to get my PhD, then do you just apply straight there out of undergrad, or how?
Some
You can
people
speak
will.
to that.
Or-
Yeah.
So it depends. And like the crazy part about psychology is that's a lot of answers. A lot of things it depends.
Right. I
No.
noticed that.
Right. So you get comfortable with it. But it really does.
I don't know.
I'm going to try to provide some help.
Thank you.
So for me, so you really have to spend some time with yourself, I think, and it required an early commitment to like doing a lot of exploration ahead of time. So I was already looking into this stuff at the beginning of my junior year. So, and for a PsyD PhD, a lot of Google, a lot of speaking with professionals. I would just find them in the phone book and call them, talk to them. And I was very fortunate to have an internship during my senior year where I got to see the different professions work together. So in my internship, there was an LMFT, there was clinical psych, counseling psych, and there was also pastoral counseling, which was like, you know, whoa, didn't even know we could throw that in there. Yeah,
That's a thing.
right, it is. And then some of them even too, they'll get like their pastoral counseling degree. I think that's through theology. I don't want to, speak too much to that because I'm not completely familiar. But then they'll also pair that with something like a clinical counseling PhD. I'm not sure about the theology piece.
I didn't see that.
Yeah. But nonetheless, that just the exposure was very helpful. And there's also opportunities to get involved in research as well. So if you're in undergrad, there was also a member in my old lab. She was post-bac. She had worked for a year. She was like, you know what, I just want to see what research is like before I apply into the program. And now she's getting her master's in counseling at U of L. So kind of studying with the information and looking at it that way. And then speaking to finances, when you get to the application period of interviews, like you're at liberty to ask those questions because you're committing yourself to 2 to 5, even 7 years of study. And at a PhD level, that's also you're committing to a person and they're committing to you as well. So while you're in your interview, and usually the programs will have a section where they talk about finances. So when I was applying, I went to an open house and they talked about even at the open house. And for them it was, we actually don't have any funding for you. So some of them will make it very clear too.
Right.
But definitely take it upon yourself to ask the questions too because you deserve to know.
I would add, so I finished my undergraduate in psychology. I was a first generation college student. I had no idea like why some people were called doctor and some people were, so I was like trying to figure it out, right? So I took some time, I worked. After my undergraduate, I would not have been competitive to apply right into a PhD. So you also have to think about what were your experiences, what is your curriculum, what does your CV look like, what does your resume look like, and then seeing if there is a fit, right? And seeing if there is a faculty, a research fit for you. So when I was coming back to graduate school, I specifically wanted to do a master's first because I had to build up my resume, I had to build up my experiences to be competitive for a PhD. So, and that was one of the reasons I started in the master's, and I was only looking at programs that had a master's that could lead into a PhD. I did not want to go to a school that didn't have a Phd and I'd have to move again. So,
so you wanted to be somewhere where you could stay
I could stay,
continue the track,
and the classes I was taking would roll into my expectations. I would already have my foot in the door, and I would have time to establish myself with a research mentor before I then asked that person to be my PhD mentor. So I was thinking kind of long game. So,
and this is an appropriate place too to mention that if you get into a master's program somewhere, unless there's an exception, it does not mean that you are going to be favored for or have a sure thing of getting into that program's PhD program. Like there's no expectation or anything
They're all
like
their
that.
own animal.
It's just you have an advantage in that they can see your work for 2 years before you're, or a year and a half before you're submitting your applications, but it's no guarantee.
No, I call it my 2-year PhD interview. So it adds some pressure.
It can be though. I think you really put an accurate representation on that.
So if you're thinking long-term PhD, that master's
It could
time
help.
it really is your
I know it helped me
Yeah.
because I didn't even understand
It can help or
universities. So
Yeah.
it can help or harm.
Yes.
Yes.
So this is a good point here. There's a question that somebody submitted, and this would be good for the two of you to get at. What is life like as a counseling psychology master's student, and then as a PhD student? So speak to let's speak to both of those. Yeah.
So yeah, as I said, I did the master's program here. I will say the master's program was different than it is now. Now it's kind of much more geared towards doctoral prep. But as a master's student, there was, I don't know, for me it was a very helpful experience, like kind of figuring out what it was I wanted. I knew I liked psychology, I knew I wanted to do therapy, but that was like about it. Kind of looking back, when I was a senior in college, I thought I knew exactly what I wanted, but no idea.
Then you find out that you don't know what you don't know, or you're just
and then Natalie came in and she's doing the master's right along with the PhD, so it's kind of a little different, whereas I then did the reapplication to a PhD. So as a master's, I mean, in both of them, you're doing a lot of different things. That's kind of been my experience throughout graduate school, is that you're wearing a lot of different hats at a lot of different times. So my week, I go to my assistantship for 20 hours where I do a lot of data stuff and program running. I teach there as well. And then I go to practicum 2 days a week where I put on my therapy hat, and then you have classes.
And can you describe what practicum is?
Oh, yeah, sorry. So practicum is our clinical experience. It's when we go into a site in the community and work with clients, get supervision, kind of learn how to do the therapy piece. So I've done my practicums. I've been at bluegrass.org, which is a community mental health. I've been at 2 college counseling centers, and now I'm at a federal prison. So totally all over the place.
Experience, though.
Yeah, a lot of different experiences.
Yeah.
And so each of those sites, you learn a lot about the different clients that you're working with. So obviously college students and inmates in a federal prison are very, very different. And I'm learning to use my skills, or maybe not at times. But generally, it's just even the setting is very different. So I'm learning to use my skills in an inpatient type of setting where I open the door and all my clients are just there. And so that's very different. And so putting on that hat, so right now this semester I go to my practicum, and then at the end of that day I come back and I'm a student. And so it's very much like a quick switching of your roles that you're doing, which I like.
So you gotta be versatile and just kind of roll with how it's gonna have to go.
And you're doing a lot, and then with all that you're also doing your own research stuff, and your own research and working with other research, and then working on dissertation stuff. So there's a lot of juggling of a lot of different things.
Are there any time management classes in any of these schools?
I give a lot of feedback on time management. I mean, because it's just hard. It's so much you're fitting.
I'm exhausted just listening to you talk about your dad.
It's not a 40-hour week.
No,
by any stretch.
And I don't think anybody
can't be
thinking about a master's program with a PhD track or otherwise thinks it's going to be 40. But at the same time, how do you guys keep from burning out before you're done?
It's a piece of it.
Sometimes it's just burn out.
And then like
So Natalie, why don't you speak to your piece, and then I know we got some questions.
And for me, and this is another cool distinction to make. So some programs, they won't couple in the master's course piece. So for me, coming straight out of a bachelor's degree, I'm fortunate to be able to experience the learning curve with master's students, which I've actually found to be really helpful. Because some programs you'll go in and you're straight PhD and it's like, boom, here we go. But I kind of have like 2 sets. So I have my cohort, and then I have the master's students as well, who really feel like siblings too, which is really cool. So we go through that together. Don't have practicum yet, but already juggling those hats. So for me, that looks like research. It looks like my assistantship, so I'm a research assistant. Coursework, thinking ahead to a research portfolio, but also thinking ahead to practicum and committees and things like that. So I kind of have like, I guess, a research hat, a class hat, a work hat, and a fall hat. And those are kind of what I go through every week. And then of course there's just the learning curve piece as well, because I think a lot of students come in and all of us are productive and dead set on making sure that we make this as perfect as possible, but you're gonna fall. It's just going to happen, and when you do, you just like collect yourself and then you write it down as a learning piece. So I have a document where it's called Things I'm Learning in Grad School. So when something happens, I just go in there and type it out.
Cried in public today.
No, honestly, little things like that.
Yeah.
And something else I didn't expect too, so like practicum is a later experience for me coming in now, but I have a counseling techniques class, and we got to the second class and our professor was like, so you're gonna be seeing volunteer clients. And I was like, oh, I just got here. So, but
Poor people.
yeah, but I actually had my first one, and like the scaffolding is there.
Yeah.
So that part too is a lot of it's shocking at the same time, but it's so cool.
Mm-hmm.
So it's it's a learning process, but it's a cool learning process. And there was something else we talked about. I can't remember. I was gonna add, but I'll come back to it. If I remember. Yeah.
So we had a question back here.
Oh, yeah, when you were talking about practicum in the different settings, is that something you get preference over, or is it just with availability where you get placed?
It's a
At most
combination.
programs?
It's a combination. So we have a practicum open house, which is in the spring semester when everybody's putting their applications together. We have members from the community who supervise our practicum students come in, and they set up tables in this room. They set up tables, and the students get a chance to kind of go around and meet them in person, get their information, and see if they get a good feel for the sites. And that's not everybody that can facilitate a practicum, but some of the people who are available on that day come. And then students create a list of 3 to 5 sites that they're interested in, and that list then goes to the faculty committee to decide, okay, your strengths are in this area, so you apply to these. Your strengths are in this area, you apply to these, and we kind of negotiate the list from there. And then you put your applications in. So it may be that you get all of your top 3 choices, and it may be that you get 2 out of 3. Or we may recommend something you hadn't even considered, and it may work well or not. Everybody eventually gets placed for a practicum, but that experience of like figuring out and interviewing and applying and all of that, I think is normally anxiety provoking for everybody involved. And I think it's just a normal part of the curve of like you're applying and you're being evaluated and being interviewed for a lot of different things at once. So it feels similar to how it feels when you're applying to graduate school.
Mm-hmm. So yeah, the programs will differ along how structured, or like some say you will go here this year, you will go here this year. Sometimes the options open up later in your career, especially once you have more skills. It just really depends. And it will vary at the master's and doctoral level as well.
Yeah, and also in our program, in the first year of the PhD, you're at the University of Kentucky Counseling Center. So that's already like put in for you to get here, which is nice, so then you don't have to deal with figuring out your practical placement before you're even started.
Let's see, we'll go with somebody who hasn't.
I'm a junior right now in the psych undergrad, and I want to work with veterans for like PTSD, like counseling and treatment. And I've kind of decided this like within this semester, so I'm absolutely lost between like master's and doctorate and clinical versus counseling. I don't really know like what's the most recommended path, or I'm absolutely lost.
You cannot work for a VA, if I'm not mistaken, with a master's degree terminal. You're going to need to have a doctorate degree. So that can help you make that decision. Now, if you take a master's on the way, that's fine. Nobody really feels like there's a way to look down on that. I would say that we have at least 3 students that I know of right now who are interested, and they've been veterans, or they are veterans, or they're interested in working with the veteran population, and we have a few relationships with VAs in this area, so students do practicum at those sites in Louisville and Lexington. I think the same applies for people in clinical programs, so I don't know if they have an emphasis on it or not, but I know that the options are still available in a clinical program. I know a lot of counseling psychologists who do VA type of work, so the relationships are established for internship, which is like that next level when you are one step away from being a licensed professional. So I think that the options are open for you in either one of those. What your goal would be is to find a faculty member who's also interested in that as a research topic, so that you're pairing your research interest with your practice interest, and that you know all the good information you need to know, the current information about veterans, and also you've got the practice skills.
I'll just add, let me give you my email, because I'll put you in touch with a psychologist I know who has done work at VAs. Right. And then also the internship year, right? So at the end of your PhD, you do a nationally matched internship, similar to what MDs would go through, right? There's an interview process, national match. So we have sites here in Lexington. a lot of people, it's recommended you apply nationally, you apply broadly to try and match for your final year. The VA will require that you graduate, you finish an APA accredited internship. So you also have to think about the program you pick. Are they getting people into accredited internships? So that could also, that outcome data could also help you think about what program do you want to land in. So yeah, and I'll give you my email address so we can connect you with someone.
Thank you. So you had a question.
What's the difference in the outcomes of a master's versus a doctorate?
Well, with the master's in counseling psychology or in clinical psychology, in some states you can get licensed as a counselor as an LPCC. In some states you cannot. Kentucky is one of those states where you cannot. There are about 10 states where you can get a funky master's level psychology licensure. In this state it's called Licensed Psychological Associate, LPA, but that takes about 5 years of supervised practice after graduation, whereas if you do a counselor master's or you do a social work master's, it's only 2 years of supervision, and so cost benefit with that.
I would add, one of the things is, if you have an idea, if you want to stay in Kentucky or if you want to be somewhere else and you kind of know where the goal is, go ahead and look at those licensure requirements. Where can I work independently with an LCSW? What additional years am I going to have to do of supervised practice? So, as I was continuing into my PhD, I had the hours, I had the class requirements, I applied for that licensed psych associate. I also had to find, I was at a site at the time that had a supervisor who was willing to be my state approved supervisor. So you kind of have to think, all right, what am I going to have to line up to be doing the work I want to do if I'm at that master's level? So, the additional piece, if you finish your PhD or your PsyD and then you're looking at the state requirements to be a licensed psychologist, you have to account, okay, I did this many more hours of supervised practicum, I did these additional classes, I can document that I have the standing to sit for the exam as a licensed psychologist. So there's really more, the reason I did it is because I wanted the independence. Mm-hmm. So I knew kind of what dynamic I wanted in my workplace. Yes. So let's be the boss.
Real talk. I said I wanted to pursue the highest possible degree that was available to me in my area of interest. I knew I wanted to be a psychologist at 16. So psychologist for me meant I needed to obtain a PhD. I didn't even understand PsyDs existed at the time, but I'm still really satisfied with my choice. At the master's level, if you want to be a tenure track assistant professor, you don't have those options available to you. You have to have a doctorate in most institutions. However, you can be a lecturer or an adjunct professor at a community college with a master's. You can teach undergraduate or 2-year degree coursework as a person with a master's degree. You can practice under supervision with a master's degree. And so if you're not worried about just having a meeting with someone once a week for the rest of your career or for 5 years of your career, then that's not a big deal. And you can still do the type of work that you're interested in with a master's degree. If you like independence though, if you like autonomy, the ability to have a private practice where it's you and you're kind of leading the ship, then the highest degree would be the one that permits you to do that. And it just gives you more options. We talked about this I think I talked about it with the master's students. So the viability of your pay looks totally different at the master's level and at the doctoral level. Probably there, in some cases, a $30,000 to $40,000 difference depending on what sites you're interested in. And you have to determine whether or not the extra 5 years is worth that amount of money to you. So I think there are valuable things you can do with the master's. You can lead as a project director on research teams. You can work for nonprofits. Like we have a lot of people now who graduated from the master's and they're like, I just want to take some time and not do this and maybe decide later if I want to do a PhD. And they work at facilities where they're doing grants or research or other therapeutic type work that's not under a license. Yeah.
We've got about 12 minutes left, so get those questions
Big
in.
questions back.
Yeah, they're good.
If you pursue a master's degree here at UK, then if you were to get into the doctorate program, would you be at that advanced standing? So you would only have probably with like 2 years and then your year for internship, or?
No, not 2 years.
Not 2.
You would have 5 years if you came in, 4 to 5 years, but typically 5 years if you came in with a master's degree. If you came in with an undergraduate degree, you're going to have those 2 years that you would do a master's degree, and then you're going to have that same amount of 5 years. So it's going to even out to be about the same amount of time you spend in graduate study.
Now, if you can do the master's at the same program that's the PhD, you'll be kind of guaranteed that the master's level classes that are required as a part of that APA accreditation, those credits will all transfer. Whereas when you change institutions, when I went from University of Missouri's counseling psych to Iowa State's PhD, I had about 60% of my credits transfer. So I saved about a year and a half, but not the full 2 years. Whereas everybody who does the master's here, 100% of those credits transfer. We don't let them take classes that won't transfer. So there's an efficiency there, but of course, you can never count on being able to get into that PhD. But it's real nice when it happens.
Yeah.
I do have a question. I am not currently a student at UK. I'm actually from an outside facility. I am a student at an undergrad student at Kentucky State University, and I don't know if you know anything about their psych department. We're awesome. I'm just gonna say. So it is much different. I'm actually at the point. I have a lot of background. Actually, I was an IT tech student, and I was 6 months away from graduating with my associate's degree in nursing when they closed. So yeah, that led me to Kentucky State University, and now I'm in a bachelor's degree program. I have had internships that we have to do specific to the studies that we do there. But I'm at this, I guess, crossroad where I need to figure out where I want my career to go, because theirs is more forensic than versus clinical or counseling. So I think at this point I need to figure out which road I want to take, check my curriculum that I have because of the fact that the transferring credits, because to me that would be a big issue at this point.
You're in a master's or a bachelor's?
I'm in the undergrad.
So none of the undergraduate classes anywhere are going to
I'm wanting to apply for my master's degree.
Oh,
I'm
gotcha.
getting my bachelor's degree.
Right.
So I'm looking at this point whether I want to try and jump to PhD, whether I want to do my master's degree, and which way I want to go with the curriculum that I already have.
Do you like to stay in forensic type of work, even if you have a different title of clinical or counseling?
That's what I'm not sure of at this point with my nursing background.
Okay.
So that's why I decided to come to the information.
Because I'm thinking about the forensic piece, so you can do that with clinical or counseling. At the master's level, you cannot. You would have to keep going with the PhD. So if you're using the master's as prep to get into a PhD, like if you feel like right now your application doesn't look the way a doctoral student's application would look, then use that pathway. But I know all of the people who work in prison settings or doing forensic assessments have doctorate degrees, whether it's a PsyD or a PhD. And PsyD programs have forensic tracks that none of the clinical or counseling programs that I know of, if you're trying to stay in the area, have. Do you guys know of any? Yeah.
Because I would rather stay either in one facility or institution or in the area, because I don't know anything on my home. I don't want to go anywhere.
I understand that totally.
So I think it comes back to like just getting clear on what kind of work lights you up, you know, and like you know where.
And I'm in that position right now.
Right. That's interesting. Yeah.
What makes your application competitive?
Yeah, so
faculty members.
Do we tell them? I know every one of you are sitting up there going, do we tell them?
I mean, we look at applications holistically. Not every program will, but we do, where even if you have a low GPA or GRE, if you have dedicated strengths in other areas of your resume, of your CV, that can make up for those low numbers. So, I mean, good GPA and GRE helps. It's good to be above the 50th percentile if you can on GRE stuff at minimum. And GPA 3.5 or above, you're solid. At least above a 3.0 helps. Below that, people will really get worried. And show, if you want to get into a PhD where it involves some research, hopefully you had some involvement in research before you applied, right? Being an RA in a research lab, or a few, hopefully longer than one semester is really helpful, so that you can find someone to write a letter about the fact that you have research skills and you're reasonably professional and stuff like that. And then if you want to get into a counseling or a clinical PhD where there's a helping component, there's a therapy component, it's good to do some sort of applied internship where you're using listening skills or helping skills or pro-social stuff, so that you can have a letter writer from there say, hey, they were warm and fuzzy and can talk with people and be supportive and stuff like that, right? Because we want to bring in people who have shown evidence in their own undergraduate or master's way that they can kind of do similar stuff. They have the potential. So I would say that.
Absolutely. So to build on that, that gets you in the door for an interview. Mm-hmm. In the interview setting, I want to see a person that knows how to treat other people, that is not trying to cut everybody's heads off to be seen, like this, not competitive but collaborative. I want a person that knows themselves and is confident in their abilities, and at the same time is teachable. And so somebody that's like really excited and curious about the things that I'm interested in as a faculty member, wants to learn. And I like people who write well and who are really bright, so that you're not a know-it-all person, but that you just have a way of understanding the world that's clearer than most people walking around. The PhD is, what, 1% to 2% of people in the world? That's a very high level of education and intelligence, and so I'm looking for the potential for that as well. And like Dr. Hammer said, for me that doesn't always get represented in test scores. So I'm really looking for you to convey that verbally in the work that we do over the course of a day-long interview.
And as you probably noticed, you've watched us and heard how we speak and how we kind of look at each other and communicate with each other, and hopefully you pick up on some warmth and some kind of care. We're looking to bring people into the family who are like that too, because we're gonna have to spend the next 6 years with you.
We really want to laugh.
And if you make us anxious or uncomfortable or irritate us or do stuff that's annoying, we don't want to bring that into the family because we try and keep a good thing going here. So counseling psych especially, we really care about your personality, and because that's going to directly connect to how effective you are as a therapist too. When you're right with yourself, you're going to do better work.
I also like people who are aware of their identities. So you recognize your privileges and marginalization and how that has shown up in your life and how it might show up in your research and your clinical work and all of that. You don't have to be perfect and I'm the ideal ally at this point. That's not what I'm asking you for, but I'm asking you for to have that awareness of self. That's really important to me, especially as a person that's committed to social justice.
Mm-hmm.
And openness to it, absolutely.
Yeah, because you go in knowing I don't know a whole hell of a lot. I'm ready to be taught. I'm open to reconsidering some of the things I thought I believed about the world, but maybe aren't quite true. Other stuff.
Yeah, I can add some stuff that helped me in the application process too. So the first being, because I talk to a lot of graduate students, and just talking with other graduate students can tell you so much. So one thing that helped was hearing that this was me search as well. So I think that really, and that's definitely, I've seen that come to fruition as a graduate student now, because like you're always evolving. And like what's cool about, if you're a person who enjoys evolving and adapting, that part's enjoyable, even though it can at times be painful, but it's fun in an odd way. Yeah, because you're growing, it's like it's growth. Yes, it's good growth. The second thing was that I remember getting really stressed out when I was waiting to hear back about interviews, and one of my peer mentors, he told me, he was like, getting the interviews means that you're overqualified. When you get to the interview and if you're not picked from there, it's because you weren't the right fit. And that goes back to, on your own, making sure that you're looking for a mentor who you feel like you can vibe with really well, who embodies what you want to be and things like that, because that's going to help you when you're sitting across from them just having a conversation. A third thing outside of that, so I was thinking back to when we were talking about just getting the interview itself and like what looks like a good applicant. What helped me feel like I was there was not only like the me search part, so doing that, but just the research piece. Because something I've observed between my peers who are in master's programs and those of us who are PhD is that some of the PhD students have more research experience there. And I can definitely say it helped me, like coming into my lab knowing that like, even though all of my experience wasn't qual, so I had minimal qual experience, but I had a lot of quant, like I had it there, and some of those things are still going to be transferable. So it made me more confident in my ability to step into like a new field of research, being qualitative and knowing that I still have some of those skills there. Whereas if I didn't have them, I don't know if I would have been as confident as I was in my interviews.
And both Carolyn and Natalie are students in my lab, so that means that they had what it took for me to be like, I like you above all the other people that applied. And that is the thing, we were talking about this in our research team meeting the other day. I was like, you know, on this side it's really fun. It's really fun because you get to meet so many great people, but even though there are 3 to 4 people who could be a possibly good fit, like what's that thing that distinguishes you above the other folks? Doesn't mean you're a better person, but it means like you really work well for this team, and I think so the team dynamics make a difference too. The research team you're applying to. Everybody doesn't need you to be warm and fuzzy. I need that. That's what I value, because you're going to be a qualitative researcher. You're going to be talking to people in their face. Like they need to like you, and you like them at a certain point. But that's not valuable to everyone. Some people want you to be a really hard worker, and you don't have to say anything to anybody as long as you get your work done, and that works well for them. And you'll get a vibe for the professor the same way we'll get a vibe for you in the interview, and then you can make your choice on that as well.
So we're almost at time. It would be a good idea for us to let them know about resources they need to know exist, because we only have an hour here, but everything we're saying here, well, not as much the personal stuff, but a lot of these truthisms are out there on the internet, so maybe we can mention some resources that we want to point them towards.
So for me, at least in the application process, there's this book that APA sells that has all of the programs in it too. I liked having the tactile place where I could put little tabs of schools I wanted to look at. It's all online too, but I think it's only like $30. It's like big and thick, and it's got all different types of programs. It's got counseling, clinical, social work, like all the different things. So if you like a hard copy thing.
The only other thing that jumps out to me, I had mentioned through the APA website, you can look at the accreditation data. You can also look and see if programs have had any probations in their accreditation, if they've had issues, new sites that are maybe recently accredited, and kind of get a sense of their reputation. And I think another important piece is when you're looking at a program, really dig down and look at their values. Look at what are they discussing on the website, what are their students talking about in their bios, what are the faculty talking about, and then being able to ask about those things if you are there on site, and see if that thread follows all the way through, so you kind of know if it's going to be a fit for you.
I would say other graduate students, so both like someone who can just sit through the process of applying and you can just go to them and be like, am I okay? I would say for my personal statement, it went through about 8 hands of graduate students, no joke, but then it also went through professors' hands too at that. So that, and then also graduate students in the sense that if you're looking at a program, because all of our information, well, mine and Carolyn's, you can find it on the website, on our email, so it's out there, and we're available to talk to you as well. So something I really appreciated, there was a student I think who was considering applying here, she reached out to our lab, and I thought that was so cool that she did that. And but I'm still thinking about her, because it's like, yeah, so, yeah, that. But yeah, so she reached out, but she had like questions, and she was like warm through email too. So it's like, I know that like, you know, December is when apps are due, and the like interviews coming up. It's like, oh, I keep thinking about her, and then I can tell Dr. Hargons about her. Okay, so.
I think in there, Natalie's also saying, like, feel free to reach out to
us.
If you go on the Counseling Psych website, you just click students, both of our names and emails will be in there. So, like, feel free to reach out to us.
So our program website, we have the larger department, our counseling psych program, and then we got pages for our master's and doctoral program where you can learn a lot about us. On my website, drjosephhammer.com, I have a resources for students page with a ton of stuff about, I've got about like 40 hours of video on different advice for applying to graduate school and stuff like that, comparing clinical to counseling, the mental health profession's career test, which will give you 21 scores on different mental health occupations to help you steer towards counseling versus clinical versus something else. Just a bunch of advice. Everything I've learned going through this process, I tried to put on the page or in video. So I recommend that. And yeah, reach out to us if you have questions about our master's program or doctoral program. Our master's program is Doctoral Prep. So it's specifically designed for people who know they want to go on to the PhD. Okay, so if you're looking for a master's program like that, ours is a particularly good fit for that. We do not focus on training people to be mental health therapists to stop at the master's level. There are other programs where that's going to be a better fit.
They do that well.
So thank you so much for joining me,
Thank you,
panelists.
guys.